Jamie? Jamie?
Is he alive? Is he breathing? Are his lips turning blue?
I don't think he's breathing. What can we do?
If you use heroin or other opioids like OxyContin or Vicodin to get high, to treat withdrawal, or to manage pain, you are at risk for an opioid overdose. An overdose occurs when a person takes more of a substance or combination of substances than the body can handle. Overdoses can be prevented. If you know someone who uses heroin or other opioids, including prescription medications, you can learn to recognize the signs of an overdose and respond. You can save a life.
I think he's overdosed. Isn't there some medication that can help? Should we call 911?
Yes, call 911.
911, what's your emergency?
My friend is unconscious. I don't think he's breathing. Please, send help to 49 Main Street in Franklin right away.
We're sending an ambulance. You need to start rescue breathing. I can talk you through it.
I know how to do that. I can do that.
Overdose can be prevented. Part of prevention is understanding what increases the risk of an overdose. Using or taking drugs alone increases the risk that an overdose will be fatal. Mixing drugs or using them with alcohol or prescribed medications and taking drugs when tolerance is reduced increases the likelihood that an overdose will occur. When tolerance is reduced, less of a drug is needed to have the same effect. Tolerance can be reduced when someone has stopped using a drug, even for just a few days, and then starts using it again. A person who has just been in a detox facility, drug treatment, or the hospital is at increased risk for overdose due to lowered tolerance. So is someone who has just been released from jail or prison. Other risks include having recently been sick and having a chronic illness like hepatitis, liver disease, kidney disease, respiratory problems, heart problems, or AIDS. Another high-risk situation is when someone doesn't know what drugs he or she is taking or how much. But it is important to emphasize that anyone can overdose if they are using drugs, including prescription medications provided by a healthcare professional. Take a look at the overdose victim on the screen. Then take note of the list of overdose risks. Click and drag the most relevant risks of an opioid overdose to the overdose victim's body. Not all the risks will apply to the overdose situation. Go ahead, give it a try. When you've identified all the applicable risks, you are finished with the exercise. Congratulations, you have completed the section, Preventing an Overdose. Please click the Next button to continue. If you know people who use or take drugs, it is important to learn to recognize the signs of an overdose. Opioid overdoses are the most common. They involve heroin or other opioids either alone or in combination. Combinations include heroin or other opioids with alcohol, depressants like benzodiazepines or benzos, or stimulants like cocaine. Overdoses caused by synthetic opioids like fentanyl are also becoming increasingly common. The signs of an opioid overdose are pretty clear. The first is that the person is non-responsive. Non-responsive means that when you call the person's name or attempt to wake the person up by rubbing their chest or sternum, the person does not respond. This is different than a drug-induced nod. If someone is nodding and has not overdosed, they will respond. In an overdose, the person may still be awake but is unable to talk, or the person may be unconscious and their body is very limp. Second, the person is breathing slowly or unevenly, or isn't breathing at all. Third, the overdose victim's lips and nail beds, their fingernails and toenails, may be turning blue or purple. And fourth, the person may be making gurgling sounds or snoring. There are other signs, slow, erratic, or no pulse, pale or clammy face. But to make it easier to remember, think in terms of the four main signs. Let's look again at our opioid overdose victim. Notice how he doesn't respond to his name being spoken, or even a hard sternum rub. Notice how he has bluish lips and nail beds. Notice how his respiration is so depressed that his breathing is hardly detectable. Notice how you can hear gurgling sounds. If help is not provided right away, this individual will stop breathing and die of a fatal opioid overdose. This quiz will help you review what you have just learned. You will see a list of symptoms. Click on and drag the key symptoms associated with an opioid overdose to the figure of the overdosed victim. When you've correctly identified all the symptoms, you will be able to move on to the next section to learn how to best respond to an opioid overdose. You can learn how to save the life of someone who is overdosing, maybe a friend, a neighbor, someone you love, someone you know from your work, or a stranger. Congratulations! You've completed the section, Recognizing the Signs of an Overdose. The best-case scenario in an overdose response is for the EMTs to arrive to assist an overdose victim who is still alive. There isn't anything they can do if the overdose victim has died. This is where you come in. You can make sure the overdose victim is still alive, maybe even sitting up and talking, by the time the EMTs or other public safety personnel arrive on the scene. How can you respond most effectively to an overdose? Let's go over the steps you need to take and focus on why each step is important. Ready? Okay, first, get help by calling 911. In many cases, you don't know how long the person has been unconscious, nor how much of the drug or drugs the overdose victim has used. You may not even be sure you know what kinds of drug or drugs have been used. Even if you have naloxone and administer it successfully, medical care may still be necessary. If you don't have naloxone, then 911 is even more important, so call 911. Give the 911 operator your location. Clearly state where you are. Then say, "My friend or someone is unconscious. She or he is not breathing, or is hardly breathing," whatever is actually happening. You can even say, "I don't know if he or she is breathing." Then administer the naloxone. We will show you how to do it. It's not hard, and we will tell you how you can get it at the end of this training. If you haven't already, start rescue breathing. An overdose victim needs oxygen. If the person isn't breathing on their own or breathing is repressed, meaning the person is breathing less than 12 breaths per minute, rescue breathing must be performed as soon as possible. Every second counts. Opioids repress or stop respiration or breathing, so the overdose victim dies from a lack of oxygen. Rescue breathing provides oxygen to the brain, which keeps the heart pumping and prevents brain damage and death until the person can breathe again on their own. If you know how to perform CPR, you can do that instead of rescue breathing. If there is no response to the first dose of naloxone after about 2 minutes, whether or not the person is breathing on their own, administer a second dose. Synthetic opioids like fentanyl are extremely potent and may require 2 or more doses of naloxone. These drugs are sometimes mixed with heroin or other drugs without the user's knowledge. Once the person starts breathing again, place the overdose victim on his or her side. This is called a recovery position, and it will prevent suffocation in case vomiting occurs. The best thing to do is stay with the person until help arrives. Paramedics and some other emergency responders have naloxone and can administer more if necessary, as well as take the person to the hospital. Now let's spend a little time talking about the importance of naloxone. Before naloxone was available, people tried different ways to revive an overdose victim. Some people used salt, milk, or cocaine shots. Others attempted to shock the person with ice or a cold shower. These are all ways to stimulate someone to respond, but a sternum rub is easier and quicker. All you have to do is make a fist and place your knuckles against the chest bone in the middle of the overdose victim's chest. Apply firm downward pressure and rub up and down across the chest. This area is called the sternum. A sternum rub inflicts a sharp, brief pain. Now try it on yourself. Good. Right away you can see if the person is responding or not. If not, you can immediately administer naloxone. Naloxone actually reverses the effects of an opioid-associated overdose on the brain. It works quickly, and it's the best option every time. Naloxone works, so make sure you follow up on this training and get some naloxone. If you don't have it, don't despair. You can still call 911 and do rescue breathing. Paramedics and in some places other public safety personnel can bring it. Perform rescue breathing until they arrive and tell you to stop, or until the overdose victim is breathing more than 12 breaths per minute. Now we'll go over how to check if someone is breathing or not, and how to do rescue breathing if the overdose victim has stopped breathing or is not breathing enough to stay alive. Think, look, listen, feel. Can you see the chest rising and falling with each breath? Can you hear the person breathing? Can you feel breath when you put your hand close to the nostrils? If not, or you are unsure, start or continue rescue breathing. How is rescue breathing done? Once you are sure there is nothing blocking the airway, gently tilt the head back, open the victim's mouth with one hand, and with the other, gently pinch the nostrils closed. Make a seal with your mouth over their mouth. Then breathe slowly, once, then twice, into the airway. Give one breath every 5 seconds or 10 to 12 per minute. Allowing 5 seconds between breaths gives time for the lungs to expel the air you've pushed in. Check to make sure the chest is rising and falling with each breath. Continue until the person starts breathing or until the ambulance arrives. When you can see, feel, or hear the person breathing, move him or her into the recovery position. Place the person on their side with their arm under their head so their mouth is facing downward. This way, all fluids will drain from the airway and the chance of suffocating is eliminated. This is also a good idea even when you are waiting for the naloxone to work, as long as the person is breathing. Otherwise, you need to continue rescue breathing, and if you have to leave for any reason, even for a moment, be sure to put the person in the recovery position.
I think there's medication. Let me go check over here. I found the medication in Jamie's bedroom. It's in this little box. It's a spray. Okay, I've taken it out of the box. There's instructions on the guide. They say, hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Like this. I've got it. Now it says, gently insert the tip of the nozzle into either nostril until fingers are on either side of the nozzle against the bottom of the person's nose. Okay, then press the plunger firmly. Okay, here we go. I hope this works. Jamie?
Usually, if you arrive in time, the naloxone will work. It will work quickly, within minutes. But the overdose victim, now a survivor, is likely to be confused and may not remember what happened. The survivor may also be uncomfortable or upset. So let's spend a little more time talking about why it's important to stay with the person until help arrives. When people are revived from the effects of the naloxone, they may want to use more of the opioid they had been using before in order to feel better again. But doing this could throw them back into a potentially lethal overdose. Your presence can help to reassure the survivor and help him or her make the right decisions. Also, the naloxone will wear off after 30 to 90 minutes, but the effect of the opioid may still be powerful enough to overcome the person again. You may need to administer a second dose if the first one wears off and help hasn't been called or hasn't arrived soon enough. You can also encourage the survivor to go to the hospital. Now, let's go over the different naloxone products that are available in the U.S. We'll start with the newest FDA-approved products. Narcan nasal spray is the device that was used to revive Jamie in the scenario you just saw. It's very easy to use. There's nothing to assemble, and each of the 2 devices in the box are pre-filled with 1 dose of naloxone. In the box, you will find this flyer, the Quick Start Guide, with clear instructions on how to use the device. How do you use Narcan nasal spray? It really is quite intuitive. As the guide explains, you hold the spray with your thumb on the bottom and your first and middle fingers on either side of the device. Then you gently insert the top of the nozzle into one nostril until your fingers on either side of the nozzle are against the bottom of the person's nose, like this. Then you press the plunger firmly to spray the entire dose of Narcan into one nostril. There's no need to spray it in both nostrils. Just spray the entire dose into one nostril. Another FDA-approved naloxone product is called Evzio. Evzio is an auto-injector. The naloxone is administered through a retractable needle to protect against accidental needle sticks. Evzio comes with a trainer, a device without the naloxone, to practice with, and both the trainer and the actual naloxone device are voice-activated. A voice talks you through the administration of naloxone. How is it used? You detach the top cover of the device to activate the voiced instructions, which tells you to place FZO on the overdose victim's thigh and press firmly for 5 seconds. If you press firmly enough, the needle will inject a dose of naloxone into the thigh, even through clothing, and then retract. All you need to do is follow the voice instructions from start to finish. Are there other naloxone products? Yes. Often they are stored in naloxone kits that look something like this. These kits are being used across the U.S. They also usually contain 2 doses of naloxone in case you need to administer a second dose. Naloxone kits also tend to contain gloves, a facial guard to be used when performing rescue breathing, and instructions on how to administer the naloxone that comes in the kit. If you would like to see how to use these non-FDA approved products so you don't have to read and think about how to use them during a medical emergency, click on the link to the appropriate product. No matter what device you use to administer naloxone, after administering 1 or 2 doses, the person should begin to respond and become revived. But what if you administer the naloxone and it doesn't work? An overdose can also be caused by a mixture of substances, so 1 dose of naloxone may not be enough. Naloxone works with opioid overdoses, but not with other kinds of overdoses like stimulant, benzodiazepine, and alcohol overdoses. But it is important to remember that administering naloxone for a stimulant or other kind of overdose won't hurt the overdose victim. Seeking help is always important in these cases. That's another reason why it is always important to call 911 with any kind of an overdose. When paramedics or other first responders arrive, they can provide more naloxone or use other emergency procedures like administering oxygen or CPR and can get the victim to a hospital as soon as possible. Unless you are sure the overdose was not caused by heroin or other opioids, the steps are the same. Call 911, administer naloxone, perform rescue breathing if needed, place the person in the recovery position, and stay with the victim until help arrives. Now let's try to put it all together. Take a look at the steps for successfully responding to an overdose listed on the screen. Click and drag the steps on the right of the screen to one of the slots on the left side of the screen in the correct order. When you have the correct steps in the correct order, you're done. Give it a try now.
The ambulance has arrived. We revived him with Narcan.
Good job. We're happy to take over from here.
You are almost finished. Here is another opportunity to review what you have learned. When you have answered all the questions correctly, you will have successfully completed this online training module. Click the Start Quiz button to begin. Congratulations! You've successfully completed the online Overdose Prevention Recognition and Response training. Once you receive your certificate of completion, be sure to find out where and how to get naloxone. There is information available on the Get Naloxone tab of the website. Many states now have standing orders which allow programs and pharmacies to distribute naloxone without the need for a medical provider to write a prescription for you. Find out if your state has a standing order for naloxone by calling your state or city or town Department of Health, or by Googling naloxone standing order and your state or city. Check out the links page of the website to find additional resources for education and support, as well as information about MAT, medication-assisted drug treatment. And be sure to pass the link to this website and the information you learn to others so they too are prepared to save a life. The development of this training module was funded by the National Institutes of Drug Abuse. Upgrades to the training module were made possible from funding provided by the Addiction Technology Transfer Center Network and Adapt Pharma.